Thank you for tuning in to watch our Invest Tampa Bay 6th Edition Leadership Summit. You're about to watch panel number 3, Team Effort, why healthcare and higher education are collaborating like never before, and the programs needed to prepare a workforce facing near-term disruption. Don't forget to like and subscribe to watch more leadership insights like these. Enjoy.
Good afternoon. As Shane said, I'm Ray Ferrara, founder and executive chair of ProVise Management Group, which is a financial planning and investment management firm with offices in both Tampa and Clearwater. We're working with about 1,100 clients scattered over 30 states and managing about $2 billion on their behalf. I also am the creator and host of a financial podcast called Up Your Assets. And you can find it at upyourassets.org. So you might ask yourself, why is somebody in the financial business involved in introducing a bunch of panelists in healthcare? You know that little game that we play sometimes when you're getting to know people? What's the secret that nobody knows about you? Well, in spite of having been in the financial business for 54 years, my degree is in zoology. Because one day I thought I might become a doctor. Like most of you in this room, I've been very involved with not-for-profits and served on numerous boards. But the one theme that has continued with me since the late 80s is the healthcare industry. I have the pleasure right now of serving on both the Morton Plant Meese boards and the Baycare boards for a number of years. And at the intersection of all of this from my particular business, you can have all the money in the world, but if you don't have your health, what difference does it make about your wealth? And so committed to making sure that our community as a volunteer is constantly improving itself, providing affordable, passionate care and accessible. So it's my pleasure to have an opportunity, recognizing to the panel I'm about to introduce that we're the only thing between us and the cocktail hour. I'd like to invite up to the stage the group that will be doing the last panel. The moderator will be Jim Schimberg, partner with Shubin Law Group, Angela Falconetti, president of Polk State College, Clifton Gooch, chair of the Neurology Vice President for Clinical and Translational Research at USF, Morsani College of Medicine, Tampa General Hospital, Eric Hall, president of Pasco County Hernando State College, and David Otati, president and CEO of Advent Health. And I would make one comment before they come on. The collaboration that is needed between healthcare and places of education, not just the college level, but other levels as well, are terribly important. You already heard earlier today, I think it was Linda, who commented that we're about 20% short of just nurses here in Florida. But we already have great health systems here, all of who have been collaborating for years. We have TGH, obviously collaborating with USF. We have Johns Hopkins collaborating with Johns Hopkins. We have Baycare collaborating with USF for a number of years, and more recently with Northwestern. We have Orlando Health collaborating with 3 universities, FSU, USF, and UCF, and that's a mouthful to remember, all the initials. So it's not something new, it's something that's existing but has to be even better than it's been in the past. So I'd please invite the panel to come up at this time.
Shout out, even though it was an I hate lawyers joke. Yeah. And second of all, when I was working for the city of Tampa, Mayor Buckhorn, back in 2011, we went on a tour with the Urban Land Institute, and we worked with some other cities around the country to try to help figure out how to rebuild our downtown and rebuild our city after the recession. And one of the things I learned by going to Providence and going to Boston and other cities was higher education and healthcare are working closely together to try to not just redevelop downtowns, but to work together to solve innovative problems. And that's what this last panel is about. So I'd like to welcome our esteemed panel, and let's jump right into it. Our closing panel is called Team Effort. So we're talking about how education and healthcare are collaborating like never before, and the programs they need in order to prepare our workforce, which is facing near-term disruptions. With AI, new technologies, and additional disruption in our traditional models of care, it's becoming increasingly clear that hospitals, colleges, training programs must be aligned to help build a skilled workforce, one that is future-proofed to deliver accessible and quality health care. So I'd like to start off by asking a question to all of the panelists, and we can just go down the list. But we're seeing rapid shifts in technology, in rapid patient demographics, as well as workforce pressures from the shrinking labor pool. So we've got new challenges to both the education and the healthcare sector. Against that backdrop, what are the new and emerging pressure points for your specific segment of the market, and why is it no longer possible to address these challenges alone? You want to start with you, Eric?
Sure. Well, good afternoon. Everybody can hear me okay? And I will apologize. I know there's a bright light up here with the head. There's a little bit of a shine. But I'm working hard to fight that gray wave that everybody's talking about. So, but it's great to be here with you. And I want to just do a shout out to my team over at Pasco Hernando State College. Had the blessing and honor of serving with an incredible team. And we're here today to really embrace this whole conversation about collaboration and how we work against some of the challenges that are existing. And I would say, first and foremost, you know, here in the state of Florida, I will say this, you know, we are very fortunate to be in a state that for almost 10 years in a row, our state colleges and university system have been ranked #1 in the nation. And there's a number of factors that contribute to that ranking, but one of the rankings that, one of the things that, you know, factor into that ranking is the affordability. You know, for the last 10 years, we've had, you know, great leaders at the state level, governors and legislature, who has really worked hard to make sure that we keep tuition, you know, at the same level for 10 years straight. So when you think about that, and we think about some of the barriers, that means that affordability, being able to get our pipeline and getting individuals to come into our fields, I think we're able to mitigate some of that. Because when you think about that from an economic standpoint, we heard earlier in panels some of the discussion about affordable housing. Yes, we have to do more in that area. But imagine now having students coming out of their programs with no debt to little debt, and now they can start to invest in those lifestyles and those dreams that many of us have when you go into school to begin with. So again, that affordability to me is one of the things that, you know, I think, yes, we're talking about barriers, but if we can keep that strategy in place and keeping education and those costs low and not, you know, having students come out with that high level of debt, is something we want to continue to prioritize. Now, that doesn't mean that it's completely accessible for everybody, right? There's still financial barriers for some. I want to give a lot of credit to our hospital partners, because through some of the relationships that we have, they're helping to invest in scholarships and helping us to build that talent pipeline. But I will tell you one of the barriers that I think in higher education that we continue to face and have to continue to work on with our partners in the healthcare arena is being able to get access to the talent that we need to provide instruction and the teaching and training programs that are in place. You know, if you imagine, if I need to have a nursing instructor and they have the option of coming and working for $50,000 a year and teaching our next generation of nurses, or work in the field itself making $80,000 or more, that's a competition, and that's a dynamic that we have to figure out how to break. We've got to figure out how to break that cycle, because obviously we want to produce the talent, but we have to have the instructors in place to be able to do that. And so I think through some innovative models and things that we can continue to build on, and I'll talk about that more later, I think those are some of the things that we can come together on and, again, recognize it as a barrier, but also recognize that's an area and an opportunity for us to come together even more focused in partnerships and extending what does the classroom model start to look like, so that we can offer those clinical experiences and things like that in a real world, you know, setting.
Sure, that's great. Dr. Gooch.
Yes, thank you. Thank you for having me here. It's a pleasure to be here with you all, discussing really critical topics today. I think it's important to emphasize the magnitude of the problem that we're facing. You know, healthcare expenditures now are 20% of GDP as of 2025. That equates to $5.7 trillion a year in the United States for healthcare. A massive, massive amount of money. It's not sustainable to continue to grow that expense as time goes on, and on the other end of the spectrum, the demand continues to grow. So what about the graying of America? We have 60 million people currently in America over the age of 65, by far the greatest consumers of healthcare because of aging. The benefits have been tremendous. They really have been afforded by tremendous advances due to research in academic medical centers and healthcare over the course of my lifetime. In 1970, which was only 5 years after Medicaid was created, which, by the way, of course, starts at age 65, the average age of survival was 65. Congress didn't choose that number by accident, so it was very cheap to maintain Medicare because many people didn't live that long. It's mind-boggling to think about that the average age of survival was only 65. My grandfather died at age 62 in the 70s. So, you know, especially as I enter my 60s, it's just kind of mind-boggling to think about that. But that is the way it was, and now people are living to be, you know, average age of survival is 80. Many go much longer than that in the United States. So Medicare was a system that was never really originally designed to keep people going 20 years beyond age of eligibility. So we have a real affordability problem here, and it's exacerbated by labor shortages. We have really not only massive increases in labor market and cost. I'm sure you all are very well familiar with that problem since the pandemic, particularly acute in healthcare. You may not realize that 25% of physicians retired during the last 5 years, a lot during the pandemic. In the next 3 years, 25% more are going to retire. So this is a labor shortage. It's also going to drive up costs further as competition for physicians intensifies. We have a similar shortage already been alluded to in nursing and in many other allied healthcare areas. So it's a big problem. It's a financial problem, and you see the fallout of this in Washington and with Congress and the administration and others trying to grapple with how to pay for all of this, and it's going to be a big challenge. So how do we solve the problem? Well, we have to think our way out of this problem. We have to be strategic. We have to be intentional. And one of the best places to sort of incubate these ideas that will eventually filter out through the entire system and help to solve our financial problem is the role of the academic medical center. So what is a true academic medical center, by the way? It's important to kind of define that, I think. So a true academic medical center involves a tight integration between a university medical school and a healthcare system in close proximity, in close collaboration, working together day by day. So you might have a physician scientist who in the morning is in a laboratory looking at mouse models of treatments for brain tumors, and then midday he's seeing patients who are receiving an experimental drug for treatment of a brain tumor, and then in the afternoon he may be doing surgery to remove a brain tumor in a partner hospital. He brings these insights, he or she, across all of these domains and begins to get new ideas about ways to treat things that filter back and forth bidirectionally to the lab and to the clinic and to the bedside. And this results in new treatments. Well, what good are new treatments? Well, not only are they kind of an economic engine unto themselves, but a new treatment, if you look at the entire healthcare system, has tremendous economic benefits for savings. For example, if we can cure Alzheimer's disease, forget about curing it, if we can just push Alzheimer's disease off by 10 years, because it is a disease of the elderly, so we can push it past the age of survival for most people so that it's not a problem, it doesn't put them in the nursing home, we can save hundreds of billions of dollars a year to the healthcare system just by that one disease alone. We actually have our first crack at Alzheimer's treatment. Many of you may have heard. So we are beginning to treat Alzheimer's disease right now. We'll see how much of an impact it has going forward. It may have an even greater impact. New other therapies for Alzheimer's are coming. How did those therapies get generated? They got generated in academic medical centers with universities in close collaboration with their medical schools in the kind of environment that I've talked about. But it's not just new cures that will solve our problem. We have to figure out how to treat the diseases that we have cheaper, better, and faster. We have to figure out how to keep people out of the hospital by maintaining health in the community. This is a whole nother area of research. It's an area of research that's focused on by schools of public health and schools of business even, as we have at USF and many other universities. And there are logical ways to go about this. And it's going to be very important to the future to maintain this health and figure out sound logical strategies. And these are going to be incubated in the academic medical centers, universities, and medical schools and disseminated across the domain. And they're going to be a very important part of figuring out how to lower the cost of health care. We have a system now that's a little bit perverse in that it incentivizes doing more no matter what. It's a perverse incentive so that if someone is a surgeon, they are paid to do more surgeries. The more surgeries they do, the more money they make. if they say, you know what, you really don't need surgery. I think you'll get physical therapy, you'll do just fine. They actually lose money. So it's crazy, right, that we have that kind of system. I think we'll talk more in the future about how things are going to be, in the few questions to come, about how the system is evolving towards maintenance of health. But the academic medical center is going to be the place where many of these ideas originate that will then pollinate across the entire healthcare system and help to solve this critical financial problem, which is upon us now and is only going to get much more acute in the next 5 years unless we do something.
Thank you. Angela?
Well, first of all, thank you so much to Invest Tampa Bay for having us here. Polk State College is a thriving college right in the center of the state, very similar to Pasco Hernando State College. Unlike my good friend Eric, I do want to let you know that I'm glad that I'm not shining up here. In all seriousness, Eric, he covered, the main mission of our Florida college system, which is to ensure that we have affordable options for students. I'd like to also talk about another portion of it, which is accessibility. Much like quality health care, we want to have quality higher education opportunities that are available to our residents. One of the former speakers quoted that 70% of students at a particular institution stayed in that location. Well, our graduates, by design, are designed to stay in that location, right? Some of them do leave, but our statistic is just that. 70% of our students stay here in Polk County, not here, this is Hillsborough naturally, but stay in Polk County and are employed in Polk County, and we're very proud of that. I do want to add to what you've said. Naturally, we know we all have our different places in higher education, from the university system and the medical model and the research, but we do really train the technicians, right? We train the nurses, and those are very, very critical positions. And we heard one of the speakers say, look at the nursing decline. So, we've had a very keen eye on at Polk State looking for additional resources. Not only access to quality education, access to quality health care, but looking for additional resources. So for example, the state of Florida, I know you remember, Eric, a couple of years ago, established a grant titled Linking Industry and Nursing Education. We have benefited from approximately $560,000. That has completely transformed our simulation labs. These students that we are training need to be trained on the high quality equipment that they're going to be utilizing when they're in the workforce, when they're working at Advent Health or other locations in which they're going to be employed. So that is very important, that we continue to look at the resources. We were also very fortunate, Eric mentioned, keeping and retaining staff. We were very fortunate to benefit from a $1.7 million donation from Advent Health to name the college's first Dean of Nursing. And that permitted us to hire a quality individual who has made things happen. We've revamped the nursing curriculum. We now have expanded the program to add 30 more students this year, and I just approved the hiring, just saw them actually, approved the hiring in the spring of 3 new full-time nursing faculty. But it takes talent, it takes leadership, and it takes vision. And those are the kind of partnerships, when you reference having partnerships, those are the kind of partnerships that are going to continue to move our higher education system forward, because things are happening. Between our associate's degree, meaning the registered nursing program, and our bachelor's degree in nursing, we are just enrolling this fall a total of 450 students. That's pretty remarkable. Yeah. Thank you. So I hope that was a good segue to my good friend David here about the quality of the partnerships and the investments from the healthcare industry. For example, that line grant, Linking Industry and Nursing Education, all of the healthcare partners in Polk County invested money, and so the state came forward and they matched it. But that's over 3 years, $560,000. And so, again, it takes leadership to make things happen. And Dave, I want to thank you for your leadership.
Maybe he's going to announce another gift right now.
Maybe. Are you?
I don't know.
All right.
No, thank you. Thank you for this opportunity. I wanted to talk a little bit about technology, if you will, because we talk about technology as a disruption in the healthcare industry, and sometimes we should look at it as an enabler as well. So, when I look back about 20 years ago, I was an administrator of a hospital there, and we were going to go live with our electronic medical records. And when you're doing that, you're disrupting every part of the organization. You're going like, all right, the paper chart's no longer here, and here we come with our electronic medical records. And I had some of the doctors were super happy. Some of them, especially the ones that are in their 60s, they're like, we're going to quit, we're going to retire. Some of you might remember that. It was like, we're going to stop that. And I remember one doc in particular, a friend of mine, he was walking through the halls, and it was like second day we go live, and he was fairly upset. He was using some choice words that ended up on my desk going like, you can't say this. And I was thinking about what I was going to do. And this is a friend of mine. I'm like, man, I know he's mad, but he'll get over it. And while I'm thinking about that, I had an interview coming up for another physician. And that physician came in, we were talking, we were interviewing, and it was a brand new graduate medical physician, just finished and ready for their first job. And it was like the physician that everybody here would want to go see. I mean, she was super nice, well-liked. And when we get done with the interview, she's like, I'd like to come to Advent Health, but I have one question. I'm like, what's your question? She says, do you have electronic medical records? And I was like, ooh, which direction is this going to go, right? And I'm like, yeah, we just went live with our electronic medical records. And she said, yes, because I've only been trained in the electronic medical records today. I've never used paper. So I'm sitting here with a document on a doctor that's mad about going live with it, and on the other side, the doctor that says, I won't join you unless you have it. Yeah. And going, here we are, this dichotomy of what we're going to do. We're going from the old to the new, and how do we progress? And as I was thinking through that, that's kind of marked me throughout the years, going, technology is going to continue coming at us from every angle, from all over. And today, Advent Health is a fairly large organization. I don't know how many folks know. We're in 9 states. We have 54 hospitals. It's a fairly big system. 13% of the folks in Florida that are admitted to an Advent Health hospital in the entire state. So it's a fairly large organization. And now we're embedding technology everywhere. We have over 60 AI applications in our systems. I mean, we are embedded in it, but we're looking at it as an enabler, not as a hindrance, of how we can improve access, how we can reduce cost, how we can continue to improve quality across our organizations, how we can leverage technology here locally and move it to a place that's more rural. Like, should a place like Wauchula, or should a place like Lake Placid experience different healthcare than what we have in a big metropolitan area? How do we move protocols? How do we move that technology? So we're actually literally in the process right now of upgrading every one of our rooms across the entire company, which is over 9 states, with smart rooms. And we're moving pretty fast to have that done in the next 6-7 months. And smart room technology across the entire company, and then leverage that technology to bring better access and better care across our system. So when you talk about technology, I look at it as an enabler, as a progression, as an improver of access and quality, and I hope to reduce the cost of healthcare through it, not to increase it, and that's the way we look at it.
Well, thank you very much. As is being the last panel, you've already heard a lot of this, so you already know that we're the last panel before the happy hour. But I'm going to go ahead and give each one of the panelists a very tough question, and hopefully get a relatively quick answer from them. We'll start with you, Eric. So in your interview with Invest, you shared how Pasco Hernando State College view your local health partners as co-creators rather than stakeholders. How does this type of partnership help both your students and the regional health-related workforce? How does it bring it together?
All right, so I'm going to try to be quick, but I will just say this. I mean, we talk about a lot of the growth in the area, right? So I would challenge anybody to look at what's happening as we go north in outside of the Tampa Bay area. If you look at anyone who can distinguish between the Pasco and Hillsborough County line going up 75, going up the Sun Coast, or going out Bruce B. Downs, I would challenge you. That means to us up in Pasco and Hernando, the growth is incredible. And I want to be able to really acknowledge the fact that our hospital partners have been just stepping up to the challenge and really working with us hand in hand. And I think that co-creator mindset is about us being responsive. You know, yes, research universities and others play a significant role, but as Angela mentioned earlier, we're producing a lot of the technicians, the nurses, and really filling that talent pipeline. And we can't do that in a vacuum. We got to make sure that we're paying attention to what's happening with the most current technologies, so that we're using those clinical spaces in a way that prepare our students to come out immediately to get into the workforce, not having to come in and get retrained on new innovations and things that are out there. I think one of the things that I have to give a lot of credit to the college and to our medical partners is that we launched something called the Institute for Nursing and Allied Health. And that institute is about having an agreement with each of our medical providers so that we can make sure that we're being responsive, having those clinical opportunities for our students. But it's also about having that agreement that says, hey, we are in this together, co-creating this model of work and learning so that, again, we're producing the talent that's needed. You know, I always tell people that, you know, relationships in the absence of accountability is irresponsible. And that's what an MOU is really about. It's making sure that we have that joint ownership and supporting the talent, supporting our students, removing those financial barriers, but making sure that they are the best trained talent possible so that they're not just coming through the door with the technical skills, but with those interpersonal skills so that they know how to respond and care in what is probably in many cases one of the worst days of somebody's life or in the lives of those that they're caring for, right? I mean, it's really about making sure that we're producing the talent, again, with the technical and interpersonal skills that are needed, but that co-creation is about having an agile environment that embraces teaching and learning in a way that is responsive to the most emerging technologies and the most emergent needs out there in the field.
That's very important, and that's great. Clifton, so I know that we've heard about the great partnership between USF and TGH. What does this partnership say about the future of healthcare and the workforce needs that we don't even know about yet?
Right. So, interestingly, I think this is a good example of how these kinds of partnerships hold tremendous benefits for the Tampa Bay area. And it wasn't always that way,
No, I know.
by the
I
way.
remember
Many
the
of you
days
remember.
it
So, actually, it was Columbia University and New York Presbyterian Hospital for 10 years before coming here. And I've been here for over 15 years now. So I came here really because USF itself had mapped a strategic plan to make them a leading research university, which they've achieved amazingly in a very short period of time. Many of you don't know this, but the applicants to our most recent medical school class have MCAT scores. Those are the scores, the tests you take to hopefully get into medical school, in the top 3% in the country. This is on par with the Harvards and Hopkins and top medical schools in the world. And that was not at all the case when I first came here, but they were on the path to this. The university's also really risen in research. We have over $700 million in research now. About 60% of that is actually in the medical school, USF Health. And that's a doubling over the last 5 years, and it continues to exponentially increase because of execution of this plan. So I came here, I have a major focus in trying to come up with new therapies, get them from the lab into humans, and I wanted to do this across the major domains of neurology, and we've done that too, and we've had great success. But what was missing is our relationship with our hospital. So for those who may not remember, not too long ago, TGH and USF were at war. It was not just they weren't getting along, they were actually at war and throwing punches at each other. The dean was calling out the president of the hospital in the newspaper and vice versa. It was crazy. It was like some reality TV show. So coming from Columbia, New York Presbyterian, this was crazy to me because that institution and that hospital both are top world class, but they also have an incredibly collaborative relationship, and this is how they're top in world class. And so it was not going anywhere. And some of you may remember David Straz, who was a fixture in the community, a leading businessman in the community for a long time. And I was sitting next to him at a charity event for a disease we were raising money for one day when this was at its height. And he leaned over to me in his kind of gruff way, no-nonsense business guy, said, "Well, what do you think of your dean?" And I said, "Well, he seems to be a nice guy. He hired me." And he said, "Well, he's got to go." And I said, "Okay." And he said, "All this business with Tampa General and TGH, this is just destructive. It's not doing the community any good. He's got to go." And he said, "The president of TGH, he's got to go too." And by the way, within 6 months, they were both gone. So that was the beginning of the solution to this horrible problem, which was not only damaging USF and TGH, but the entire Tampa Bay area and the community of Tampa Bay. So we got two visionary leaders, which was a tremendous boon. One, of course, John Kouros, you've already heard from him, a leading CEO nationally in healthcare systems. And then we got Charlie Lockwood, who many of you also know, who's one of the leading deans. Actually, he just became the chair of the council responsible for accrediting medical schools throughout the entire United States. He has many other leadership positions, is a fabulous clinician, scientist, academic dean, very engaged with the community. And together, they both understood academic medicine and academic medical centers and the importance of the collaboration between a hospital partner and its medical school. And they forged this alliance, which has brought tremendous benefit and raised both of them up to these tremendous heights. And Tampa General has also risen to become really a hospital known not just throughout the region, but now across the entire nation, really, for many of its excellent programs. #1 in transplant in the United States, for example. We're doing cutting-edge surgeries in neurosurgery with computerized devices to cure neurological disease, for example. We could go on and on about all that. But the benefits to Tampa Bay have been the creation of the medical district and the bringing of new equipment, devices, jobs, and companies to the Tampa Bay area. So John mentioned Medtronic. That's one of many companies, by the way, one of the largest medical device manufacturers in the world, coming now with an outpost in Tampa Bay. We have several other similar programs that are coming. For example, we just the last couple of years got this device called a functional MRI, which can, I won't go into a long story about that, but it's a device that can sort of read your mind. It's used in research, you can ask me about it later, but it's used in research around the world. We didn't have one. I managed to get a federal grant with the help of Jane Castor, approved for payment of part of this. They're very expensive. The state kicked in with some lobbying effort on the part with some help from TGH, but also USF lobbyists and Charlie. And then John said we also had to get the price down, because those of you who dealt with the state, you may realize you tell the state, well, this is going to cost $6 million. And they say, okay, well, here's $4. Figure it out. So I went to John and I said, John, we got that, and Charlie too. I said, we got this problem. It's 6, but we only have 4 million. And Charlie said, you know what? I know the chair at GE. Let me call them up, the CEO, and let me talk to them. And he did, and they came down. And we made cut corners here and there. We were able to make it work. So that fMRI, which is a key research instrument, would not have been here without this partnership. That's one of many such examples. And the feed effect is that as these big pharma, as device manufacturers, many other allied companies come to cluster around the health district and the academic medical center because they're looking for the brain trust that they need to do their work, then it's going to really have a synergistic effect on growing jobs and boosting the economy of Tampa Bay, which of course is on its own amazing trajectory over the last decade. Right. And so those are a couple of examples of how this works in action.
Thanks, that's great. Angela, let's get back to the state college system for a second. And you guys have an upcoming simulation hospital. You've experienced rapid growth in Polk County. What role are you playing with sort of aligning the training with the care needs in the community? And tell us a little bit about the great things you guys are doing.
So you just asked me a question about one of the things I'm really passionate about, so get ready for this. But first I'd like to, before I directly answer your question, I'd like to talk about outcomes, return on investment, especially for those who have invested, right? I mean, we look at our nursing program, for example. Our dean called me recently and said, oh, Dr. Falconetti, we're now at 96-point-something% pass rate with the national NCLEX exam. We had been 4 semesters in a row, our students were passing at 100%. The majority of our health sciences, and for those of you who are not aware of what we offer at Polk State, we offer ranging anywhere from radiography to cardiovascular technology, to sonography, to medical coding, to physical therapy assistants, to occupational therapy assistants. We created the first dean of health sciences. The majority of those programs, the students graduate, and when they test for their exams, the national exams, they test at 100% pass rate. So the issue for us was not the quality of the education that we're providing. The potential, I'm going to call it an opportunity because it wasn't an issue, was the space. So how as an institution, as we all know, Eric knows especially, how as an institution are we going to most effectively serve the increasing need for healthcare professionals? And the way to do it was to have not only additional space in the form of a new building that we are building in Haines City, Davenport. It's approximately a $51 million project altogether. We are almost finalized with it. The legislature just came through with an additional $10 million donation, and we have $7.5 million that we need remaining to make that come to fruition. But it's not just about the building, right? And it's not just about giving them more space. Although the space is important, because in order for the programs to grow, we need to have additional space, additional equipment. And so that facility will permit for our healthcare programs to grow to most effectively meet the healthcare needs. But it's also about the synergy of putting all of the health sciences into one facility. We will still have nursing on 2 of our main campuses, but nursing will travel there to be taught in one facility where they can work across disciplines. And so we are creating, thank you for asking, what we're calling a simulation hospital. It's essentially, from my perspective, like an emergency room. So to give you an example of how these things continue and the need for partnerships and these conversations continue, David, you don't know this yet, but I did meet with your president over at Heart of Florida Hospital, Advent Health, just the other day for lunch, and we started talking about the smart technology that Advent Health is going to be employing in their facility. So we started brainstorming about how we can make that happen in the simulation space. So what this simulation hospital will do is it'll permit us to have similar partnerships that you've mentioned with the practitioners, with doctors, with nurses, those practitioners where our students can learn real live scenarios. We also offer an EMS, EMT, EMR programs. The paramedic programs, they primarily, our students pass at 100%. So we'll be able to work with them across disciplines, all of our healthcare sciences in one facility, learning from each other, partnering with healthcare partners, learning from the experts, and in the end, have an evaluation of the whole process as a team. And in my estimation, there's nothing more powerful than being able to grow our programs, but also be able to collaborate with our partners. It's critical for the future, and also to be able to provide our students the quality education that they need.
Well, that's awesome. Thanks, Angela. So, David, last question. So, Advent Health has, I think, over 20,000 team members within this area. How are you partnering with the educational institutions to continue to grow this workforce and make sure that they're well trained to be able to help your needs? Besides working with Angela and Eric here.
No, I appreciate that. So Advent Health, right now, last year we surpassed 100,000 people within Advent Health. So it's a fairly large system. About 60,000 work in Florida. And in the West Florida division, we have about 20,000 people in West Florida, the division that we're responsible for here. And I believe it's crucial to continue to partner with all of our colleges and universities, like Eric mentioned, like Angela mentioned, because you can't wait till you have a crisis. If you see that in your organization or in your business you're having some issues, work with your current and your local universities or colleges to develop folks, because it takes time. It takes time to develop it, and also takes investments. So within Advent Health, we invest very heavily in our universities, in our colleges, not just with our money, but also with our people and our time. We have their folks come through our labs. We have learning centers set up just for the university, for the teams to come through there. We've upstaffed those areas with additional preceptors, with additional staff, so they can get hands-on training. So for us, we work with high schools. We have over 300 high school students roaming through our hospitals, learning about what options healthcare has, because you want to expose them to something at a fairly young age, so that they'll be like, maybe I should go into healthcare, and then maybe I can go into the colleges and universities. And then when I get done, we may know them because you've already been roaming through our organization, and then we can hire you as well. So it's almost like a 360 kind of a closed circuit. You're trying to get them early on and educate them all the way through, so that when they join us, that they already have an advantage, because they know our system, they know our how we work. So for me, invested in our local education is crucial for every county to do, every community to do, for businesses around this room to do as well, and work with your local entity. So that's the workforce going in. I'll give you one more minute. For the workforce that's in our organization, you've got to invest in them as well. So the folks that are in our organization, we do have different classes that we can go, both in our colleges and universities and also locally. One thing that we've noticed, that if you are in an educational system, whether it's our clinical ladders or so forth, and working for us, our retention of you is 95% plus. So our turnover rate's less than 5% if you're inside what we've seen in our organization, and actually in some type of learning mode. And when you're learning, our ability to retain you is much higher than if you're not in a learning mode. So for us, investing in the health, investing in the education is not only important for people's lives, but also for our retention as well.
Well, that's great. That's a great answer. And I want to thank our panel. I really wish we had another 2 hours to talk about this stuff, because we have a lot more information, a lot more material, but I think we've probably shared enough. I want to thank everybody, and thank everybody for being here. I think there's a final comment, but thank you guys.